I have the prerogative as moderator to start off the perspective and present to you what currently WHO is undertaking in terms of infodemic management. It's something we build as we go with this pandemic, so there are still a lot of lessons learned for us to take on. But we hope to learn from all of you today and see what can we do in addition to support, better support to the many countries and communities affected currently by the COVID-19 pandemic and infodemic. Let me start off with my presentation. So what you see on this first slide here is just on the left side, really a perspective view of how we are looking at different information access points. Now, below you see a picture of 1916 during the Spanish flu pandemic, and just 100 years later, the way people consume information. And the really difference here is really the speed and the way people have access to information today and receive and consume this. On the right top corner, you see something very much in the behavior. We often see that certain information, rumors, misinformation, draw attention of people. And the question is, how can we move people to more consume an accurate and evidence-based information and seek solutions in the way we can present information that is more accessible to individuals. On the lower corner, you see just a snapshot from last month's media articles that are circulating worldwide. This is based on assessment of 70 languages, looking at how much share of COVID-19 articles have been published. And here we see only on the Sunday, it's been 110,000 articles that were published on Sunday, only on COVID-19 itself. So this is the three challenges we're looking at. First is how people access information nowadays. The second is the quality of the content that is being provided. And thirdly, the quantity of information they are tackling. So how can we address it in a cohesive infodemic management framework to take on these challenges, but also provide solutions? Dr. Briand already mentioned in her opening remarks, there's a key principle that underlies our work. We truly believe that individuals and communities can better protect themselves by having timely access and understanding of the collected knowledge and wisdom from trusted sources, and are engaged as part of the solution. Now, taking these key principles in mind, we're looking at different areas in WHO, how we address an infodemic management strategy. So what you see here, it's a very busy slide, but let me walk you through this. So on the first level, we believe that that what we do and what we communicate needs to be based in evidence. And this is where WHO has a special role, because we have the opportunity to communicate with our member states, with countries that are directly affected, and receive and collate information directly from the field. We have the opportunity to talk to physicians directly in the hospitals that are treating the first patients of COVID-19 and understand from them what they see on the ground. This information we try to collate, bring to the attention of scientific networks. And this is where you see we're holding on a daily basis, several dozens of teleconferences where we pull in this knowledge from different sources and experts to have an understanding and evaluation of the information. We have a whole team looking at all scientific publications that are being published, try to vet them, to understand them, to evaluate them, and see what is relevant that we can share. The second level, once we have identified this evidence, is how do we simplify the knowledge, which means how do we interpret and explain what is known. It's not only to push out data information, but they need to be interpreted and brought into context. And for this also, WHO works with a network expert to really present information in different ways that is actionable. So what you can see, we have a weekly slide set of summarizing the evidence and the knowledge we gain from the field. We have started a series that we're calling the Mythbuster series, where we really tackle misinformation and false information and try to provide the right evidence to this. The third point, you see a graphic there, flattening the curve. Actually, this is not a WHO product, but I still picked it up because I found it quite genuine, how to try to visualize science in a way that people can understand. I would assume most people have not seen an epidemic curve before, but what I've seen on social media the last couple of months in trying to visualize and make science more understandable was quite genuine. Thirdly, what we're trying to do also is to provide infographics and information in a way that target specific groups of people. And you see something we created for the workplace, and how people can still go to workplace but still keep safe, and taking what we know about physical distancing, hand washing into place, that still certain jobs can still continue even though we are in a pandemic. The third level of interaction as part of our framework is really looking at amplifying the action. WHO is only one voice, but we try to bring in other sectors in society that are trusted pillars to take WHO advice and adapt it for their consideration. We're working with a large set of faith-based organizations to discuss with them how certain services can continue in the context of COVID-19, or what needs to stop momentarily just to protect the ones that they are caring for. And we're doing this for different sectors, including for employers, unions, health professionals, large event organizations. We're in direct dialogue with them and see how our advice can be adapted for these communities. But beside that, we're also engaging with social media platforms like Facebook, Google, Twitter, and how they all named, to place the right information in the viewpoint of people consuming information from these social media platforms. If you lately looked at Facebook, there is a COVID information center where authoritative advice from WHO or national health authorities are placed, so people have quicker access to the right information. The fourth area, and this is really something we're building up, is really understanding and quantifying the infodemic. Really seeing what is being discussed in social media, understanding the sentiments of people, and trying to pick up things early, pick up things that are emerging from the social discussion we're seeing, and see if we can respond quicker with the right risk communication, with the right technical advice for people to better protect themselves. So basically, these are 4 buckets of our infodemic management strategy: identify the evidence, simplify the knowledge, amplify the action, and quantify the impact.